You're watching CTOM TV. Knowledge is power.
So Deborah would like to know, good question, Deborah. What is radiation therapy and why is it used instead of chemo?
So radiation therapy, as you know, is a form of ionizing energy, ionizing radiation. It basically damages DNA in replicating cells, non-replicating cells, and it's a form of treatment that can target inside the body without actually having to do surgery.
So because it damages DNA, it's damaging those stem cells.
Yes. Yes.
And so that's how it works.
Yes.
The question was, why is it used instead of chemo? I often hear of people getting the two together. So,
Yes,
but
yeah.
why might it be used instead?
Well, because it's targeted. Chemo is body-wide, whereas with radiation, you target tumors individually.
Okay. And recently, maybe now it's maybe almost been 10 years since we first heard about something like brachytherapy,
yes,
which is a highly targeted.
Actually, brachytherapy's been around since the early 1900s.
No.
Yes.
Oh gosh.
Yes,
Okay.
Well, it's had many.
I heard about it 10 years ago.
It's had many reoccurrences over time.
But that is highly targeted.
Yes, it is.
Right.
Yes.
So there's kind of the broader type of radiation, which is still more targeted than chemo, as you're saying. But then there's even more highly targeted.
Yeah. The benefits of brachytherapy is it typically leads to similar results as external beam radiation. But the beauty of it is it involves little seeds, little rods or radioactive seeds that have a different type of radiation. The type of radiation used in brachytherapy doesn't penetrate very far. So it's got a short distance for penetration, but within that distance, the radiation is very intense. Whereas external beam radiation is typically a different isotope, and it's going to have different properties. So the benefit of brachytherapy is it doesn't go very deep, and it only affects the target area. So that's one of the benefits. One of the disadvantages is you need a surgeon and you need a radiation oncologist to be involved in the process of it. So it's not used as much as external beam, where a nurse can just run the machine.
But I know in Canada, there are hospitals that do that treatment, and others
it's
that
not
don't.
as common in Canada.
Not as common.
Yeah, and that's because of the high cost of it.
Yeah, having the two
doctors required. Yeah.
Okay. Well, thanks very much for that question, Deborah.
Thank you for watching CTOM TV. Subscribe below and stay informed.